when thinking about the treatment strategy and planning your finances, which is going to be important for anyone, and especially more so for solo women, for women over 40 who are funding this alone, what criteria do you think they most need to consider when they're trying to select where to invest their money?
Well, I think that the most important element of choosing a clinic or a doctor is comfort. So if you feel comfortable with your doctor, whether your journey is successful or unsuccessful, you're at least going to come out of it less traumatized than you otherwise would. There's a very good friend of mine who has a PhD in fertility psychology. And I did an interview with her, and during that interview, she said, all fertility patients carry trauma, and that trauma follows them, excuse me, regardless of whether they are successful or unsuccessful. And so it's really important for us to make sure that we are providing care for patients that addresses the patient as a whole. It's not just about get a baby. It's about getting a baby, but also about the journey that gets you there. So if you feel dismissed by your doctor, if you feel like they're not willing to engage in dialogue, if you feel like you're being pushed into therapies and you don't get answers, those are all red flags. You should not be engaging with that team or that clinic or that doctor. If you feel like you're having a dialogue, if you feel like you're leaving feeling informed, educated, if you feel like your doctor is willing to, I don't want to say negotiate, but listen and hear you out, and then provide constructive feedback and information, then those are things that, make sense. And that's where you want to invest your money, because successful or unsuccessful, if you come out of it traumatized, that's hard to endure for anyone. So I think comfort is a hugely important facet of this. Every clinic is going to have a decent success rate. Nobody's going to be 50% better than anyone else or 100% better than anyone else. People, as a general rule, are going to just do well, and they're going to be expecting a reasonable degree of success. What we are not going to see is the same delivery of care across doctors and clinics. You're going to see virtually the same success rates everywhere you go, but you are going to see a huge difference in the quality of the care that's delivered. The quantifiers or the numbers are going to be relatively the same. I think it's one of the clinics in the UK, and I don't need to get into names, states that they have the highest success rate, and their success rate, I think they said, was 52 or 54% live birth per embryo transfer, which quite frankly is not a number I consider to be very good. I mean, we're way higher than that. But the point is, everybody's roughly around that same level. It's not like one person or clinic is getting 10% and the other clinic's getting 53%. The reality is everyone's hovering around that range. But what's the journey like from A to your 53% success rate? That's what really varies between clinic to clinic and doctor to doctor. And so I think patients need to very much focus on which clinic provides them with the best care overall. There was a very good example I'd love to share. I was speaking with an American patient who had a physician that she at least claimed was, or alleged was, Ivy League trained. And so, obviously you're expecting someone highly intelligent and capable in that scenario. I don't think anyone would begrudge you for that assumption. And so she said she had asked about mini-stim. And the physician's response to her was, "You are wasting our time. We will not discuss this again. I know what I'm doing, and you need to listen to us." And the alarms are going off in my head, because I'm saying, first of all, that's just a horrible way to treat anybody, let alone an absolute violation of every physician-patient boundary and oath and obligation that there is. Medicine has moved far past the age of pedantic, paternalistic, I'm the doctor, you're the foolish, ignorant patient. Patients are coming in already informed. They're listening to podcasts, they're watching shows, they're searching things on the internet. Now it's even worse or better, I guess, depending on your perspective, physician or patient, because now we have AI. You can jump on an app and the app will tell you what the right course of action is. So physicians who have that mentality, and I do find it's unfortunately very common in the UK, but also common elsewhere, are going to sink unless they learn to catch up with the times. If people go into their patient's fertility care saying, I'm the doctor, I know better, you're not going to be successful no matter what you do, because patients are already well past that everywhere. And I think a lot of doctors are playing catch up. I think one of the reasons we're so successful is I learned that about 10 years ago and caught on and jumped on board with everybody and said, yeah, we need to do a better job. We need to provide better education. We need to inform. We need to dialogue. So I think those are the key elements of choosing.